Hey Journey members, I am reporting live this morning from the American Society of Breast Surgeons in Las Vegas, and I have some surprise guests this morning. I'm going to introduce you to,
Dun, dun, dun.
drum roll, the famous Dr. Minas Chrysopoulo.
Famous. Infamous.
Yes, and tell them what you got this morning.
What did I get? I got this incredible one-of-a-kind pin. It's not really one of a kind though, is it?
Well, yeah, it is.
Is it?
Yes. And so while he's standing here, I have some other surprises for you too. I would like to quickly introduce you. This is Dr. Lucy De La Cruz. She is at MedStar Georgetown, and she has done one of our videos for us, our YouTube videos. What are you learning at the conference?
Everything, and actually, right now they're going to stop my favorite part of this session, which is the top 10 papers of the year. It's the highlight for me of this whole meeting. Aside from a lot of the scientific, lectures, but this is one of my top favorites. So,
okay, thank you.
Everybody must watch.
Thank you for stopping by the booth.
Thank
Bye.
you.
We'll see you later. Okay, so Dr. Chrysopoulo, tell them a little bit about shared decision making and why you're wearing this pin and why it is so important in the process of your surgical options after mastectomy.
Oh man, I thought this was going to be a quickie, but now you're loading that question on me.
No pressure.
No pressure. Yeah. Well, listen. So as I look around the exhibit hall, there's a nice stretch here of different advocacy organizations, really with different messages, right? So advocating for different things. But what strikes me is the fact that you're all together, which for me is the big point of shared decision making. And I know on social media sometimes things can get a little bit tribal with what the best option is, but ultimately I think it's really important to remember that the final decision, the final choice, whatever that surgery may be.
We're across from the food.
Yeah. Whatever your final option or final choice is, it doesn't really matter. It doesn't matter that it's different to someone else's. It doesn't matter if you got a deep flap or if you got an implant or if you went with breast conservation, lumpectomy radiation, or oncoplastic surgery, or you chose aesthetic flat closure. It doesn't matter which option you chose. What matters is that you had the options and you were able to work through them with your healthcare team and have input in the treatment decision making. And your healthcare team needs to know about you, needs to know what's important to you, needs to know your situation, what you value in your life, what you need to get back to, your job, what you enjoy doing. All these things are really important before you can decide the best way forward, especially when it comes to surgery. Mm-hmm. And obviously when it comes to cancer care, it's not just about the surgery. There's a ton of other options. Which chemotherapy, whether you have radiation, all sorts of things.
Well, and one of the things that I really like about this conference, Dr. C, is that they've really emphasized survivorship.
Yeah.
And I know that when we're newly diagnosed, it's a very emotional time for us. It's hard to kind of sort out what are things going to look like beyond that diagnosis. So I encourage all of you that are watching, because that's something they have emphasized at the conference, get all your questions sorted out so you can go and have those shared decision-making conversations, but also think in your mind, what is my life going to look like a year after I go see Dr. C or whichever surgeon you go to for whatever procedure you have, and think about your survivorship plan too.
That's a really, really important point. As physicians, we forget, or sometimes we just don't realize, that 99% of patients' decision-making moments happen outside of the conversations with us. It's really the shared decision making that we talk about in terms of the conversation with your physician, nurse, or whoever. That's probably 1% of the time. The other stuff, as you're navigating through the diagnosis and everything that comes with it, all the other decisions that are in play happen outside of the clinic and outside of the hospital, right? So there's a shared decision-making aspect to all of that, and that's why I think that what you're doing, Terry, and the other great advocacy organizations that are out there, that's so important, because it actually helps out with the biggest component of time, which is when the patient is outside of the office, the clinic, the hospital. So thank you so much for doing this.
Well,
thank you for being there for so many people. It's huge.
Well, you're very welcome, but I always say this is a team effort.
Absolutely.
I've told some of the surgeons that have stopped by this weekend that, one of them was just asking, I'd never met them before, and they said, well, what you're providing by being able to talk to, you docs and everything, is it makes the patient feel like you're kind of having a practice consult before you actually go to your real consult.
That's a good point.
So to be able to sit and listen to you on a YouTube video, or to Dr. De La Cruz, or any of the docs that we've done YouTube videos with or podcasts, you can listen to them, kind of formulate some ideas in your head, and be ready for your consult.
And they also kind of get to know us a little bit ahead of time, which.
Yeah.
Because some of the stuff that people know, I don't realize that I've said on videos. It's kind of scary. It's like they'll come and say, hey, it's like, how'd you know that? Terry, damn it, Terry. Yeah.
Okay,
so,
well, it's going to be really good.
Yeah.
Hey,
no,
Amy.
it's good.
Okay, so I'm holding the phone, and if it's starting to shake, it's because my arm's getting tired. We'll have some more surprises for you, hopefully, during the conference. But Dr. C, thank you so much for stopping by. It's good to see you.
Always.
All right.
See you
take
later.
care. All right. Bye.